Thank you very much, Albert, and thank you everyone who has made time to join us. Um, this is a very important topic for various reasons, and I would touch briefly on that. Um, this is a weekend when people are supposed to be resting from their work days. It's part of mental well-being. And so I will not bore you with long presentation. I'll speak for roughly 20 minutes and then we will be done. If there are any questions or contributions, we'll be happy to take them as Albert allows. So one may ask, why are we concerned about mental health at the workplace? I'm sure we all know that working is good for our mental health. If you are unemployed, you are likely to be distressed about boredom at home, idleness, and your inability to earn income. And so the fact that one is working in itself is good for our mental health. However, if the workplace or if the work environment is negative, it can adversely affect both our physical and our mental health. So negative working environment lead to physical and mental health problems. And that is why it's important that we talk about mental health and good mental health in the workplace. Again, it's been shown that adults spend about a third of their 24 hours of their lifetime at the workplace. Sometimes it goes beyond a third of our entire life. And so why not make sure that the place that we spend a lot of time, we make sure that that place is conducive enough, that place is not affecting our mental health. And then lastly, studies have shown that if we spend $4, if we spend $1 in talking about how to make the working place more mental health friendly, or we spend $1 in putting structures in place that would boost our mental health, research says that we are able to save up to $4 in investment or in productivity. It means that diseases or illnesses that would have arisen out of poor mental health can be prevented if we invest in good mental health and mental friendly workplaces. It's also been shown that depression and anxiety have a significant economic impact. An estimated cost of about $1 trillion is spent just because, or is lost, or is spent on diseases like depression and anxiety because these disorders. And so if we are able to prevent mental disorders like anxiety and depression, economy up to $1 trillion every year. And guess what? That money could have been put in better investments in road constructions, in schools, added to our salaries for us to get better income. Again, at the workplace, stress, harassment, and bullying are a commonly reported problem, and these issues can have substantial adverse impacts on mental health. What are some of the consequences of negative work environment? First of all, there is an overall rise in mental health problems when the environment is negative. Problems like presenteeism. Presenteeism is when people are reporting to work all right, but their output is below what is expected. Other consequences are harmful use of substances and alcohol. When the work environment is negative and it's bad, people resort to using substances so that they will cope. Other consequences include anxiety disorders, depression, psychosis, eventually absenteeism, and then eventually lost productivity. Interestingly, workplaces that promote good mental health and support people who have been diagnosed with mental disorders are likely to reduce reports of absenteeism. They increase productivity, and the staff and the employers benefit from the associated economic gains. There are many effective actions that as employers and even as employees, we can take to promote good mental health at the workplace. And when we're able to do that, these actions will benefit productivity. At the workplace, there are a couple of risk factors for mental breakdown, and some of the risks are related to our interactions between the type of work. Some people indulge in very risky activities at work. If you operate a big machinery, if you have to stand in the sun all day, if your work is risky, that alone predispose you to mental breakdown because you constantly go to work fearing the worst could happen. It's like you take each day at a time, hoping that the worst scenario does not happen. Other risk factors to mental breakdown at the workplace involves organizational and managerial environment, how your superiors handle issues at work, handle the employees, are all important. And then skills and competencies of employees. There are people who are very skilled at what they do. Some are not. Some are also skilled and competent, but there aren't enough resources for them to carry out their jobs. This is the plight of some doctors in this country who have traveled out of the country to learn very, very key skills in their line of work, but they come back home to practice and there are no machines, no resources for them to be able to carry out and demonstrate their skills. And that can be very distressing. And I think this story is very familiar in not just the health sector, but other sectors of employment also. Again, the support, the unavailable support for employees to carry out their work, support in several aspects. Are they being supported to train more, to build up their skills? Are they getting support from their managers, their immediate supervisors? All of these, do you have someone who will correct you and guide you in your line of work? All of these things can impact on our mental health arising from our work. Inadequate health and safety policies. When there is fire outbreak, you know what you should do at the workplace. If someone collapses at the workplace, you know what you should do, and yet you constantly go to work and close as if you know that nothing will happen. When there is poor communication, poor management practices, limited participation in decision making are all issues that lead to poor mental health at the workplace. Low levels of support for employees, and this stems down to workplaces with no employee assistance program. Now, employee assistance program is a new kid on the block, and I'll talk a little bit about it. If some of these support systems are not available, it makes you vulnerable and puts you at risk of mental breakdown. When your workplace has inflexible working hours and unclear tasks, like we move according to where the wind blows. You don't know what to do next or what is even expected of you. You are at work till the work is done. No clear working hours are all issues that promote poor mental health at work. That is not all. Bullying and psychosocial and psychological harassment, unsuitable tasks for persons who do not have the required competencies, and lack of team support or team cohesion and support. When at the workplace, people have been put into factions, that people have groups that they click with, or there are various cliques. It does not promote good mental health at the workplace. So how do we create a mentally healthy workplace? We describe a mentally healthy workplace as a place where workers and managers actively contribute to the working environment by promoting and protecting the health, safety, and well-being of all employees. Further, mentally healthy or friendly workplace are those places that value the health of their employees, and this include the mental health and well-being of employees. And they are not just concerned, but they have put in specific policies and practices in place. Some of these specific policies and practices include treating mental illness with the same urgency they treat physical illness. If an employee calls their boss and says, I was involved in an RTA, that's a road traffic accident, and I have a fracture, immediately some employees will be dispatched, the HR manager will be dispatched to the hospital. Hey, one of our workers has been involved in an accident. Let's go and check up on them. Let's make sure that everything is fine. There is money for them to be sent to theater, buy medications. Do we apply the same urgency when an employee calls in and say that I feel depressed, I'm going through anxiety, I'm struggling with sleep at night? Do we think that they are just being lazy? If we want to promote a mental health friendly workplace, we should recognize that mental disorders are also important, and we should treat them with the utmost importance as we treat physical illnesses. Again, a mental health friendly workplace is one that promotes a healthy work and life balance. You make sure that if the mother is a nursing mother and is breastfeeding, you allow that mother to go home. You employ the full labor laws, that working mother would work half day and they can go home and take care of the baby until the labor laws allows them to work full time. You don't just let the work be work. There are times that you say, look, we are having a company dinner, a company outing, or excursion, just to make sure that people would work and have fun at the same time. Such working environment also provide training for managers and supervisors on mental health issues, so that these supervisors and managers can recognize the early onset of mental health symptoms or mental disorder symptoms in their staff and give them appropriate help. Additionally, mental health friendly workplace support employees in seeking treatment. They safeguard employee health information, and they provide employees referral resources as EAP. EAP, like I said earlier, is Employee Assistance Program. These are well-being programs put in place by psychiatrists, psychologists, that ensure on a day-to-day basis that employers are in their utmost mental and psychological well-being, that they don't make mistakes whilst at work, they are at their best in terms of productivity, and at the end of the day, their physical and mental health are also safeguarded. If we want to create a mentally healthy workplace, interventions should be three-pronged. The first is to protect the mental health by reducing work-related risk factors. If the person works at a height that they always have to climb a tall pole, what are the measures we want to put in place for them so that going to work does not necessarily promote anxiety, or does not yield anxiety on a day-to-day basis? Another approach will be to develop positive aspects of work and the strengths of the employees. If you realize that this employee is good at secretarial area, promote them in that area. Let them take courses. Let them take professional educational programs in that area to enhance with. And then lastly, address mental health problems regardless of the cause. If you identify mental disorders in your employees, or they come with a doctor's report or a mental disorder, please accept it, recognize it, validate their problems, and put in measures to address these health issues. As helps is that we can learn from organization, young company. It's good that you take deliberate efforts to learn from other companies who are doing well and thriving well, and take some good cues from some of the things they have done. One of the things that also help employees to be in good mental health is to recognize and reward the contributions that they bring on board. And so we encourage most companies and workplaces to put in place things like the Best Worker of the Year award, the Best Worker of the Month award. These are things that encourage employees and promote their output. We also are encouraged to enforce health and safety policies like identifying when a staff is in distress, identifying when a staff is using illicit drugs. If a staff comes to work and they are drunk, or they are smelling of cigarette or smelling of marijuana, what do we do? Do we openly embarrass the person or immediately dismiss the person? No. If the person could not control themselves and they have come to work drunk or smelling of some smoke or illicit substance, then it means that something is wrong somewhere. Instead of taking the punitive action, let us approach this situation from the area or from the stance of support and be able to refer the person appropriately. We also encourage that at the workplace, we inform staff that support is available. This can be put on staff platform, on notices around, and we advise that every institution should have their own mental health professional or mental health focal person. It could be a psychiatrist, it could be a clinical psychologist, it could be a mental health nurse. It is advisable that each company or institution gets their own mental health focal person so that the staff can be appropriately referred or given support whenever the need arises. Research shows that unemployment, particularly long-term unemployment, can have detrimental impact on our mental health. Many of the initiatives I have outlined may help individuals who have mental disorders, but in particular, flexible working hours, job reassignment, and addressing negative workplace dynamics, and support and confidential communication with management are things that can help people who have already been diagnosed with mental illness and they need to return back to work. When someone has been diagnosed of depression or anxiety, etc., when they have to come back to work, sometimes it is necessary that we assign them, or we give them flexible hours. Some of them take medications that may make them a bit drowsy in the early hours of the day. Could you consider giving them jobs that require that they are more active, maybe from midday to later, or you make them work half day, or you put them at a place where they do not have to sit for long hours so that they don't doze off, so that they don't feel marginalized just because they were diagnosed with a mental disorder. It's important, in conclusion, to note that key to success is involving stakeholders and staff at all levels when providing protection, promotion, and support interventions, and when monitoring their effectiveness. There is an article 27 of the UN Convention on Rights of Persons with Disability that provides a legally binding global framework to promote rights of people with disabilities. And this disability include psychosocial disability, that is people with mental disorders and mental breakdown. This article says that we should recognize that every person with a disability has the right to work. And so if you are an employer or a colleague at work, the fact that your colleague has been diagnosed with a mental disorder does not mean that they should be dismissed. They have the right to work. They should be treated equally and should not be discriminated against, and they should be given support at the workplace. If we enforce some of these rights of people with psychosocial disabilities, they would be able to open up about their disabilities rather than hiding them and making a lot of mistakes to cost the company. Thank you very much for your attention. I will end here for now. Over to you, Albert.
Thank you very much, Dr. Ruth Owusu-Antwi. Thank you very much for such a detailed presentation. I enjoyed every bit of it. I'm sure almost everybody who is logged in live enjoyed every bit. And those who are going to watch it on the recorded version as well, I'm very sure you're going to enjoy. Now it's time for questions and answers. If you have any questions regarding what Dr. Ruth Owusu-Antwi shared with respect to mental health at the workplace, please feel free, drop it in the chat box, and she will gladly respond to your questions. Please drop it in the chat box in the comment section, and she will gladly respond to it. I have a question. My first question to you, Doc, is that when you talk about confidential communication among management with respect to sometimes the diagnosis, mental disorders, diagnosis with respect to mental disorders, who is allowed to be privy to the diagnosis of staff? And how can they ensure that such info is confidentially protected?
Thank you very much, Albert. I think probably only the HR. The staff has the right to withhold their specific diagnosis from you. My mental diagnosis is depression or is schizophrenia, or staff knows that I am dealing with a mental health issue, mental disorder is enough. This is because the HR or the manager is not a health professional or the implications of your diagnosis. And so knowing the details may not be of any whatever. If the company has a focal person, they may hold the exact diagnosis and be able to advise appropriately the HR. So if anybody at all should know the diagnosis, I think just the HR is enough. Nobody else should know. And even with that, if the staff or the employee says, I don't want them to know my exact diagnosis, it's enough that they know that I am dealing with a mental health issue, that should also be accepted. And it is the right of the staff to keep their diagnosis confidential. And we urge all such HR managers or any other in managerial position who has the privilege, and I call it a privilege, to know the diagnosis of any staff, to keep it in confidence or to keep it confidential. This is because we all are dealing with something. The fact that one person's diagnosis is out does not mean that you are totally protected. Anybody can break down at any point in time. Mental disorders are no respecter of persons, and you treat others how you want them to treat you. So if we find out that someone's disorder has leaked, any manager or any employer should put in committees to investigate. That way, employees will know how managers or employees cherish confidentiality when it comes to health matters, and then it will boost their confidence to open up about their health issues at the workplace. Thank you.
Thank you very much, Doc. That was a very elaborate answer. Yes, I like where you said mental disorders are no respecter of persons, and we should learn to treat people the same way we want to be treated. Very, very. Now, in the same vein, there are certain companies that will insist on knowing the diagnosis. They'll keep insisting that the person should, the person's diagnosis should be known by the HR, maybe the MD, and then the CEO. Doc, I know you said it, but what do you make of that? Where they insist on knowing the exact specific diagnosis, and they want the HR to know the MD and then the CEO. What do you make of that?
In situations when I have been when I have encountered some of these insistent MDs and HR, I also insist that my report would only be detailed if it is addressed to the company's doctor. When the company has an attached medical professional, we can communicate on a doctor to who is not a health professional. They have no right to insist and demand the full medical history of the employee. But some companies, physicians or attached mental health professionals, health professionals. If it is a doctor, the company's doctor, I will write or I can write and give the full details to that company doctor. Of course, with the consent of the employee. The consent of the employee is very important. Without it, you cannot divulge any information, and the mental health law will fully back such a person with a disorder. It is their right not to divulge their diagnosis to anybody. Even now, when it comes to HIV, in between couples, the individuals have the right to keep their diagnosis from their partners. And so in the same vein, mental health disorders or mental disorders should not closed if the patient or the staff is not comfortable with it. Thank you.
All right, thank you very much, Doc. There's another question in the chat box. Someone is asking, you mentioned in your presentation that every person has a right to work. Even people with mental disorders have the right to work. What if the person is a health worker and develop any mental health challenge? Can the person still be allowed to work? That's a question.
Kindly take the question again, please.
Okay, so the person is alluding to the fact that you mentioned that everyone has the right to work, including people with mental disorders. So he's asking, what if the person involved is a health worker who has developed a mental health challenge? Should the person be allowed to work?
So there's a caveat there. What that law states is that do not dismiss somebody just because they have had a diagnosis of a mental disorder. If the person is a health professional and they have a diagnosis of a mental disorder, so far as they are on their treatment, they can work fully. They can work fully. You do not have to discriminate against the person. In some instances, you would not necessarily dismiss the person, but you may have to reassign them. Instead of maybe being at the theater, you may have to reassign them to the consulting room, and they will still function as health professionals. But the law does not allow any employer to dismiss anyone just on the basis that you have been diagnosed with a mental disorder. Anybody with a diagnosis of mental disorder, provided they are on their medications or they are following their treatment, their management protocol, their treatment plan, they can function fully and continue to do the work they were doing before they were diagnosed with a disorder. Thank you.
All right, thank you very much. If you have any question, please drop it in the chat box in the comment section, and our expert will handle it beautifully for you. So I have another question, Doc. My question is, we know currently in the country, mental health services are not covered under the NHIS. In cases where an employee comes down with any mental health challenge, who bears the cost?
That is interesting and important question. Yes, mental disorders are not covered under the NHIS, but soon it would be covered. Currently, many of the private health insurance cover mental disorders. And at the workplace, I would throw back to the person the same question. If the person has a fracture or they collapsed at work, who will take care of it? Maybe that stroke the person had at work or that hypoglycemia the person had at work, when they are rushed to the hospital, their health insurance will be pulled and be taken care of. But we all know, you and I, we all know that the national health insurance does not 100% cover everything. Who pays for the rest? So in many of the workplaces, there are welfare policies that takes care of the worker or the employee when they are ill. And it must include illnesses like mental illness, because mental disorders are not spiritual illnesses. They are not cases. They are also illnesses. So if there is a welfare policy at the workplace that takes care of the well-being and health issues of employees, mental disorders and breakdowns should be considered under such welfare policies. If there aren't any, this is probably the wake-up call that institutions should start putting up such policies and welfare policies to support their own employee. Thank you.
All right, thank you very much. Thank you. If you have any more questions, please kindly drop it in the chat box in the comment section so that Dr. Ruth can handle it for us beautifully. Thank you very much, Doc, for the answers to all the questions so far. If you have any question, please drop it in the chat box. We have a few minutes to go. Dr. Ruth is still available to handle any concerns with respect to mental health at the workplace. She gave us a very detailed and insightful presentation. So if you have any questions, please feel free to drop it in the chat box in the comment section so that she can handle it for us all. Any questions, any concerns, please drop it in the chat box so that she can handle it for us beautifully. Now, before somebody drops a question, I have another one. So at places where we know currently it's difficult to get a job in Ghana. So in places where you talk about harassment and bullying, if you are being bullied by your boss, you are being harassed by your boss, and it's a private company, how should you handle it? The reason why I'm asking is the risk of being sacked once you report, because it's a private company, it's not government company. That's why I'm asking.
Albert, did I hear something about bullying? Did you say what we can do about it?
Yes, I'm saying that in cases where you're working in a private company and you are being bullied or being harassed by your boss, how should you handle it? Taking into cognizance the fact that there is a risk of you being sacked, losing your job. Should you report it? So I'm asking, how should it be handled?
Yes, in a private institution or a private company, it may be even more difficult, but by all means, speak up. If you have a boss, there is definitely another boss. Every boss have their own boss. If this person is a district boss, go to the regional boss. If it's a regional boss, go to the national director, the national manager, national boss, whatever. By all means, talk to somebody. If it is the overall boss, talk to a colleague, talk to your HR, or go to the police and report. This is your right, and only you can save yourself from this situation. If you keep quiet about it, that harassing boss would continue to harass employees, and at the end of the day, people's mental health will suffer. It is you who will go home and cannot sleep, will feel anxious, will feel depressed, will feel like a dirty rag because your boss is using you, or your boss is bullying you or harassing you. And so take your mental health in your hands and report it and say no to bullying at the workplace. Sometimes, and I agree, sometimes it may cost you your job, but guess what? You have saved yourself from a long-term mental breakdown that may require that you're on medications for a long time, and you have saved other employees who might have come after you and would have been victims of the bullying and harassment from this boss. So if one person starts speaking, it's going to save a lot of people. Bullying and harassment are still going on at the workplace because people have refused to speak up. Let us speak up by all means, no matter what.
All right. So you heard it from the expert. By all means, speak up. You may end up losing your job, but you are helping yourself and other people as well. Bullying and harassment keeps happening because nobody is speaking up. So by all means, speak up to help yourself and that of other people who may also not have been speaking up all this while. Thank you very much, Dr. Ruth. So somebody has a suggestion that in other countries, there is a quarterly assessment of employers by employees and vice versa. Is that common in our jurisdiction as well? Hello, Dr. Ruth. All right, I think she's having a bit of a network issue. We are grateful that she was able
Albert, I'm right here. What?
Okay, all right.
You said there was such a rule in the country?
No, I'm asking that someone is putting in the chat box that in other jurisdictions, there's a quarterly assessment of the employers by the employees and vice versa, quarterly assessment. So the employees assess their bosses and their bosses also assess them.
Right.
I think anonymously. Right. Is that also common in our jurisdiction?
Yes, that is beginning to happen a lot in our jurisdiction. At least in KUST where I lecture, that happens every semester. There's a cross assessment. Students assess lecturers unanimously, and this is confidential assessment. And then lecturers also have the right, also are allowed to assess their students and their the whole term, how teaching has been. And so that has been very important and helpful to reduce some of these harassment and bullying in the university environment, which otherwise was a very fertile ground for bullying and harassment. Like, let me harass you and give you some grades. But now with this cross examination or assessment, it is going down remarkably at the tertiary institutions.
All right, thank you very much. And for those of us who join us a little late, please feel free to subscribe to the YouTube channel. I'll be dropping the recording in a few minutes after we are off. Feel free to subscribe and put the notifications button on. And the next thing I want you to do for us is to share. share the recording when it is shared so that as many people as possible can get the knowledge that was shared by our expert this afternoon. Thank you very much, Dr. Ruth. If there are any questions, we have 30 seconds more. If there are any more questions, please drop in the chat box in the comment section. The presentation was very, very insightful and very thorough. So we got every point. If there are any questions, please drop it in the chat box in the next 10 seconds so that our expert can help us. She is the current head of department of psychiatry at the Komfo Anokye Teaching Hospital. She is a senior specialist psychiatrist and a senior lecturer at KNUST. She is the past president of Psychiatric Association of Ghana. She's a woman of many hats, many laurels, all right? She's very, very hardworking, a family woman. She's my senior at the top. You understand what I'm saying? Yeah, so we are blessed to have her share with us on the mental health at the workplace today. So if you have any questions, please feel free, drop it in the chat box, and she is an expert. She will gladly attend to it. If you have any question, please drop it in the chat box so that she can help us. Now, I want to just ask a final question. You talked about employee assistant program, EAP. Can you just summarize it a little? What most companies, organizations should be doing in that respect? Because I don't see it too often in our part of the world. How often, what should they be doing? The EAP, according to the EAP.
Yes, Albert, a lot of things go into the EAP. There are a couple of companies I provide EAP for, and it entails a whole lot. But in summary, we go more into details about how employees on a day-to-day basis can ensure that they are in good mental well-being and where to get help. We try to promote conversations about mental health freely at the workplace so that people can freely tell their colleague during lunchtime, for instance, talk about the fact that Chale, nowadays I can't sleep well, or Chale, I feel down, I feel depressed, or I'm making mistakes at work, I think I'm not well. And aside that, we take the employees as well as the managers through a lot of education such that they are able to recognize early signs of mental breakdown. And when you catch these symptoms very early, you are able to give the needed support. One of the measures I have put in place as part of EAP for the companies I provide EAP for is what we call the buddy system. So as a means of as a mandatory requirement, each employee, is supposed to have somebody they recognize as a buddy. That buddy, you give them the permission to hint you when they see that things are going wrong with you or things have changed with you. That buddy is the first person who can say that Chale, otherwise, when you leave it open like that, when people have drawn their colleagues' attention to their change in behaviors, there is that feeling that, hey, Charlie, I don't ask him about that man. Do you think I'm going crazy or what? What do you think? What are you trying to say? People easily get offended. But when you have given the right to your buddy, they have the right to draw your attention. And then beyond that, we put in a measure where the buddy can now take the issue to, just in case they drew your attention and you are still in denial. There are specific steps and channels. Who is a whistleblower? Where does it go? Where does it end? And what measures come in? At which point the psychiatrist can come in. And so these are things that make the workplace mentally healthy and friendly. Posters, short inscriptions about mental health is all over the workplace, in the banking halls, at their canteens, in the manager's office, and there are regular mental health talks as well. And there's easy access to support. This is a summary of what goes on into EAP. And again, there's a provision of free lines that are active 24, call 24/7, day or night, to get immediate help. When put in place, boost the employees' confidence that, look, my employer has my back. They really think of me. They don't just want me to work and make money for the company. They are spending money on me to have employed a psychiatrist, get stressed at a point in time, just in any time that there is somebody they have paid to take care of me 24/7. That alone boosts the employees' confidence, and they work even harder to improve productivity. So wherever EAP has been put in place, immediately soon after, the employer starts seeing increase in productivity, and that encourages them a lot. Thank you.
All right, thank you very much. Thank you very much. So just to clarify, do you mean that in the buddy system, if I notice something about my colleague at the workplace, I'm allowed to seek help on their behalf, as a report to maybe the HR and maybe escalate it to see the mental health expert? Is that what you're saying?
No, the buddy is between you and the person. The buddy is two people, a buddy, a friend, that I am the one allowed to tell you that, Charlie, nowadays I don't see you well. Nowadays you come to work and you've isolated yourself. Nowadays I see that the least you get angry. Let us talk to the EAP focal person. Let us get help. It is only when things get to the extreme that the body can now bring to the attention of whoever is next in command, depend on what pertains at each workplace, so that they can take it up from there. But many a times, once it is you that gave your body the permission, they are ready to listen when you have drawn their attention. This is usually somebody who is not in competition with you, so they are not lying to you when they say that things have changed with you. They are people who have your welfare at heart. And they are not people who have been assigned to you. You select your body. So these are people you yourself have confidence in the first place.
All right, thank you very much. That was very good. Thank you. Yeah, those who joined us recently, Francis, yes, the recording will be shared. Just make sure you subscribe to the YouTube channel and put the notifications button on. I will share the recording shortly after. And yes, I will seek permission from Dr. Ruth if she agrees for me to share the slides with anyone who may want. I've put my contact number there too. And then Norbert was saying, somebody was talking about a patient. So you say you've taken your person to many hospitals. Please make sure your brother sees a psychiatrist at any nearest hospital. Any district hospital has a mental health unit. And if there's a need, they can escalate for your brother to see a psychiatrist. You say your brother has been behaving somehow abnormal for some time. You've visited so many hospitals. Please make sure your brother sees a psychiatrist and there is help available. That is what you need to do. Go to any district hospital, go to the mental health unit. They will assess and possibly give a referral for your brother to see a psychiatrist. Thank you very much. Yes, we'll be sharing the recording on the YouTube channel very shortly. Thank you very much, Dr. Ruth Owusu-Antwi, Head of Department Psychiatry, Komfo Anokye Teaching Hospital, Senior Lecturer, KNUST. We are glad you came to give us this wonderful expose. It was very, very insightful. Please, do you have any final parting words to give us?
So although I talk about mental health at the workplace, that employers should ensure that the mental health of their employees is top notch and is going on well. I always end some of these sessions with the fact that each one of us is primarily responsible for their own mental well-being. Do not wait for your employer to take the action. Take the action in making sure that you yourself are in good mental health first. If your employer adds onto it, it becomes bonus. But please don't wait for somebody to take care of you. Make your mental well-being your personal priority, even first, before your employer comes in. Thank you.
Thank you very much. So we are responsible for our mental well-being. If your employer adds to it, that is a bonus. That is a plus. Thank you very much, Dr. Ruth Usu-Nchi, for sharing with us on the mental health at the workplace. Thank you very much, every single one of you, for taking time out of your busy schedule to join us. And thank you for sharing the link to invite your friends over. Those of us who have joined us late, please don't worry. We're going to share the recording on the YouTube channel. So just subscribe and put the notifications button on, and do us one favor. Share the recording to as many people as possible when it is uploaded onto the YouTube channel. Now, we are in the Purple Month. It's a month we have assigned by the Mental Health Authority for mental health awareness creation nationwide. This is one of those. And next week, we're going to have another talk on mental health, different topics. The last 2-3 weeks, we've been having lots of topics. We talked about maternal mental health. We talked about adolescent mental health. And today we talk about mental health at the workplace. Next week, we have another exciting topic for discussion. Thank you very much for making time. Until I see you again, it's been a pleasing pleasure serving you all.